Snakes, these fascinating creatures have been both revered and feared throughout human history. These slithering reptiles often evoke fear and fascination in equal measure. From ancient myths to modern-day encounters, snakes have always captured our imagination. While many people are apprehensive of snakes, it's important to remember they play a vital role in our ecosystem. They help control pest populations and maintain the balance of nature. Snakes are diverse creatures found in various habitats across the globe. From the dense rainforests to arid deserts, they have adapted to thrive in a multitude of environments. Not all snakes are harmful to humans. In fact, many species are completely harmless and play a crucial role in their ecosystems. In fact, the majority of snake species are non-venomous. These snakes pose no threat to humans and are often beneficial in controlling rodent populations. Understanding snakes, their behavior, and the potential dangers they pose is crucial for peaceful coexistence. By learning more about these creatures, we can reduce unnecessary fear and appreciate their role in nature. Most snakes prefer to avoid human interaction. They are shy creatures that would rather flee than confront a potential threat. They're more likely to retreat than attack unless threatened or provoked. When a snake feels cornered, it may display defensive behaviors. But this is usually a last resort. Snake bites, while a cause for concern, are relatively uncommon. Most bites occur when humans accidentally step on or try to handle a snake. Often these incidents occur when humans unknowingly venture into a snake's territory or attempt to handle them. Awareness and caution can significantly reduce the risk of snake bites. It's important to note that even a non-venomous snake bite can cause injury. The bite itself can be painful and may lead to infection if not treated properly. The bite itself can be painful and may lead to infection if not treated properly. Immediate first aid and medical attention are essential to prevent complications. By learning about snake behavior, identifying venomous species, and taking appropriate precautions, we can minimize the risk of encountering these creatures negatively. Education and respect for these reptiles are key to coexisting with them peacefully. A snake bite, whether from a venomous or non-venomous species, is essentially a puncture wound caused by the snake's teeth. The severity of the bite depends on the size and species of the snake and whether it injects venom. Non-venomous snake bites typically leave small puncture wounds from the teeth. These bites may bleed slightly and cause localized pain, swelling, and bruising. While not life-threatening, it's important to clean the wound thoroughly to prevent infection. Venomous snake bites, on the other hand, can have much more severe consequences. The venom injected through the snake's fangs contains toxins that can affect various bodily functions. The effects of a venomous snake bite can vary depending on the type of snake, the amount of venom injected, and the individual's sensitivity to the venom. Distinguishing between venomous and non-venomous snake bites is crucial for determining the appropriate course of action. This knowledge can be the difference between life and death, especially in remote areas where medical help might not be immediately available. While it's always best to err on the side of caution and seek medical attention after any snake bite, understanding the signs can provide critical information. Knowing the difference can help alleviate anxiety and guide first aid measures. Immediate and correct first aid can significantly improve the outcome for the victim. Non-venomous snake bites, as mentioned earlier, leave small puncture wounds from the teeth. These bites are generally less severe but should still be treated with care to prevent infection. You may see rows of small teeth marks. These marks are usually shallow and less painful compared to venomous bites. There might be slight bleeding, localized pain, and swelling. These symptoms are typically manageable with basic first aid, such as cleaning the wound and applying a bandage. Venomous snake bites often present more distinctive signs. Recognizing these signs early can be crucial for effective treatment. The most telling indicator is the presence of 1 or 2 large puncture wounds from the fangs, often accompanied by immediate, intense pain. This pain can be excruciating and may spread quickly from the bite site. Other symptoms that may indicate a venomous snake bite include rapid swelling and discoloration at the bite site, nausea and vomiting, dizziness and weakness, difficulty breathing, increased heart rate, numbness or tingling sensations, and blurred vision. These symptoms require immediate medical attention to prevent serious complications or even death. Being bitten by a snake can be a frightening experience, but it's crucial to remain calm and act swiftly. The following steps can be taken immediately after a snake bite. First, move away from the snake. Your safety is paramount. Ensure you are a safe distance from the snake to avoid further bites. Next, restrict movement. Keep the bitten area as still as possible to slow down the spread of venom if present. Immobilize the affected limb with a splint or sling if possible. Then, remove constrictive items. Take off any jewelry or tight clothing near the bite site, as swelling may occur. Finally, clean the wound. Gently wash the bite area with soap and water. Cover the wound with a clean, dry dressing. Section 5. Seeking help, medical treatment for snake bites. Medical attention is vital after a snake bite, even if you're unsure whether the snake was venomous. The first step is to remain calm and try to remember the snake's appearance, as this information can be crucial for medical professionals. Contact emergency services immediately or have someone drive you to the nearest hospital. If you're alone, call for help and try to stay as still as possible to slow the spread of venom. Time is of the essence when treating snake bites, especially venomous ones. The quicker you receive medical attention, the better the chances of a full recovery. Medical professionals are equipped to assess the severity of the bite and administer the appropriate treatment. They will check for signs of envenomation and monitor your vital signs closely. Treatment for snake bites typically involves several steps. The first priority is to stabilize the patient and prevent the venom from causing further harm. Anti-venom. In cases of venomous snake bites, anti-venom is the most effective treatment. It works by neutralizing the venom's toxic effects and is administered intravenously. Anti-venom contains antibodies that neutralize the venom's toxic effects. The dosage and type of anti-venom depend on the species of snake and the severity of the bite. Wound care. Doctors will thoroughly clean and dress the wound to prevent infection. This step is crucial as snake bites can introduce harmful bacteria into the body. Supportive care. Depending on the severity of the bite and the individual's reaction, supportive care may include pain management, hydration, and monitoring vital signs. In some cases, additional treatments such as antibiotics or tetanus shots may be necessary to ensure a full recovery. Section 6. Venomous varieties. Understanding the dangers. While it's essential to treat all snake bites with caution, understanding the types of venomous snakes and the specific effects of their venom can further aid in treatment. Some of the most well-known venomous snakes include cobras. Known for their distinctive hoods, cobras possess neurotoxic venom that affects the nervous system, causing paralysis. Vipers including rattlesnakes and adders have hemotoxic venom that disrupts blood clotting, leading to internal bleeding. Sea snakes. Found in marine environments, sea snakes possess potent neurotoxic venom that can cause muscle paralysis and respiratory failure. Section 7. Preventing the bite. Safety tips around snakes. Prevention is always better than cure when it comes to snake bites. By taking simple precautions and being mindful of our surroundings, we can significantly reduce the risk of encountering these creatures negatively. Here are some safety tips. Be aware of your surroundings. When venturing into areas where snakes are common, pay attention to your surroundings. Watch where you step and be cautious when placing your hands in crevices or under rocks. Wear protective clothing. When hiking or working in areas known to harbor snakes, wear long pants tucked into boots, thick socks, and gloves. Avoid approaching snakes. Give snakes a wide berth. Do not attempt to handle, capture, or kill snakes, as this increases your chances of being bitten. Section 8. Dispelling myths. Common misconceptions. Snake bites often evoke fear and misinformation. It's important to dispel common myths surrounding snake bites. Myth: you can suck out venom from a snake bite. This is ineffective and can even worsen the injury. Myth: all snakes are venomous. The majority of snake species are non-venomous. Myth: killing a snake after a bite is necessary for identification. It's not recommended to kill or capture the snake. Section 9. Respecting nature's rope. Coexisting with snakes. Snakes, though often feared, are integral parts of the ecosystem. They help control rodent populations and play a role in maintaining a balanced environment. By understanding snake behavior, respecting their space, and taking appropriate precautions, we can coexist peacefully with these fascinating creatures and appreciate them for the vital role they play in our natural world. Remember, snakes are more afraid of us than we are of them. By following the safety tips outlined above, we can minimize the risk of snake bites and foster a sense of respect for these often misunderstood reptiles.